Very, very appreciative of our sign language individuals that are here. We appreciate that immensely to get our word out. And also Dr. Roos, who is the Chief Medical Officer for Trinity, Mercy Trinity Hospital. Unfortunately, he's unable to attend. He is away, so I have a statement. And Dr. Kerouac, the President and CEO of Bay State Health System, is unable to attend, but in his stead is Dr. Sarah Hessler is here, and she's the infectious disease specialist, hospital epidemiologist, so we really appreciate that. As we have done before, I'll give a brief update, and then before I have my cabinet heads come up, we'll have the Bay State and Mercy Trinity officials speak, and then take questions immediately from the press for them. Again, Dr. Roos will not be here, but Dr. Hessler is here, so they can get back to the important things that they need to do at their respected hospitals. So, again, we did not have a bad weekend. Numbers Friday were 11. That's the first time we've been double digits in 7 days or 10 days. And then we went back down to 4, Sunday 4. So all total of the COVID cases here in the city of Springfield, 2,722 total cases. Unfortunately, and again, our thoughts and prayers and sympathy and encouragement go out to the affected families. We had 4 more deaths that have occurred here in the city of Springfield. That brings the death total to 124. 68 of those are residential, 56 are long-term care facilities. The breakdown, and Commissioner Helen Carlton-Harris will go more into her report, but just briefly, white is 56, which is about 45.16%. Black is 29, which is 23.83%. Hispanic is 37, 29.83%. Asian is holding at 1.61%. Our senior meals continue to go out to be delivered. And we had, I was with Helen and her senior team of Sandy Federico and a whole crew there. We had a senior car parade at the Ray Jordan Senior Center. It was absolutely wonderful. I believe there was well over 200 cars. Helen informs me 214 cars, and it was just the camaraderie. They miss being there. They appreciate what Helen and Sandy and the whole Elder Affairs crew continue to do. We had a tremendous amount of giveaways that we did, fun things, food, and masks that we gave away, and some keenly decorated cars and trucks. But it was the best meeting of my day. So Helen, to you and Sandy and crew, I'm very appreciative. We continue to stay very engaged with our senior population. Can't wait to get them back in all our senior centers, especially the Ray Jordan Senior Center. On the homeless front, again, we have done, everybody working together, a very, very good job on it. We had one more homeless individual tested positive, but when you look at it, south of 200, under about 200 homelessness or in jeopardy of being homelessness, only 12 total had tested positive. So this one has come after a while. We didn't have any testing positive. That individual is being aided. Helen informs me on that. Also, on the police front, Commissioner Clapprood indicates to me that no one is out on COVID. That's very, very good. They continue to make arrests and take guns off the street. They took 3 more guns off the street this weekend and made 2 more arrests. They saved some young kids, children's lives in the Walmart Plaza. In these temperatures we have with the high humidity, a parent was in Walmart shopping, and the police responded and got those kids out of the cars and made arrests. So they're doing those guardian angel things too, which we appreciate. Commissioner Calvi on the fire side indicates that no one is out on COVID. They did a hell of a job. Alderman Street, my old stomping grounds. I lived on Lower Dickinson Street. That was a 3-alarm blaze Friday evening. Major heat and humidity there. Bobby, how you doing? How's Mom doing, all right? That was a side light there. But the firefighters did a tremendous job not allowing that fire to spread. There was a couple of our firefighters, minor injuries, they're okay. Everybody got out safe. And Commissioner Calvi will speak on that. An investigation continues on that 3-alarm blaze on Alderman Street Friday evening. DPW Director Chris Signoli indicates to me they're down 2 on COVID. Services are going strong. There might be some delays, obviously vacation time coming up, but all services are going forward. Superintendent Warwick again indicates to me that our meal program, which we're continuing throughout the summer, well over 1.6 million meals continue to be served, and that is breakfast, lunch, dinner, and snacks to our students, families, and residents of the area. Summer school started. It's going well. Again, the superintendent indicates to me there's 3 plans for reopening in the fall. There's completely in, hybrid, and remote. He seems to think that the state, Commissioner Riley and DESE, really are looking for that hybrid form. We'll keep you updated on that situation. Financial front, my CAFO, TJ Plan, indicates to me that we have deficit spent $7 million, COVID concerns, COVID-19 concerns, to make sure we provide for our residents and business community. My financial picture is trending about $500,000 down on payments coming in compared to last year, and that goes with taxes, golf, MGM, parking tickets, so we're monitoring that. Some things are coming back in the fold now. Pat Sullivan with Parks and Facilities done a great job. Splash pads are going very well. I went by a number of them this past week, and the kids and families are utilizing them, and we want them to keep cool. The Phase 3 Governor Baker's guidelines, Emma's Place, the Forest Park Carriage House, King Philip Stockade will now be open following those guidelines, and Pat will go into that. And through the governor's guidelines, and being an old catcher who wore the tools of ignorance in high school and Legion and college ball, baseball, softball are allowed to start following the stringent guidelines, and golf tournaments, and Pat will go into that, are able to start following guidelines. Only a certain number can be done at that point in time. These are less or very limited contact sports. The other high contact sports on public health we cannot do at this point in time. Tim Sheen, my Chief Development Officer, Echo Dev, we're just finishing up the 3rd phase of Prime the Pump, and I think awards will be announced sometime this week. This is, again, we've put out nearly almost $2 million, and this is for businesses that are having trouble reopening. The nonprofits, 10 applications have come in for $217,000. We have $250,000 there, and that's COVID-19 related. And then the regular CDBG program funding, some announcements will be coming out on that moving forward. My city solicitor, Ed Pakula, did inform me that he took the difficult task of being able to go into MGM this past Friday, and he indicated to me that he felt safe and didn't have any issues, and it was wonderful. So he did some clandestine work. I don't know if he won or he lost, but he was there. Bill Mahoney, our HR and Labor Director, Attorney Mahoney, indicates to me, we don't have the Springfield numbers, but nationally unemployment is down 11.1. That's down from 14%. We'll see if that trend holds moving forward. So with that, before I bring up Dr. Hessler, and I'm really appreciative that you're here, let me just read a brief statement from Dr. Roos, again, who is he's away, unable to be here today. So his brief statement indicates, this past week at Mercy Medical Center was one full of both celebration and caution. As was noted last Monday, after 16 consecutive weeks of caring for hospitalized patients with COVID, we achieved the milestone of having 0 0 COVID positive patients in our hospital, something that we could not have accomplished at this time without the efforts of everyone working together to reduce the impact of COVID in our community. We believe that that deserves to be recognized again, so we thank all of you for all you've done thus far to help us stay safe and be healthy and recover. Yet, with the dramatic rising of coronavirus infections across the country and the lack of the ability to create immunity through a safe and effective vaccine, we knew that it would not last too long. And after 4 days of no hospitalization of COVID patients, we are now caring for 2 hospitalized patients with COVID, one whom is in the he or she is in the ICU. In addition, we've also seen the percentage of positive tests increase slightly from 2% to 3% over the past several days. Accordingly, we at Mercy are exercising caution and are quite concerned about the rate of increase in infections across the country and in states like Florida, Texas, and Arizona. The curve of the new infections in the United States should sound a clear alarm that if public health measures are not followed consistently and vigorously, the virus will certainly return, and it can return at any moment. So you hear that constantly from Dr. Roos, Dr. Kerouac, and Helen Carlton-Harris and myself. So at Mercy, we remain vigilant and will not be changing the processes and procedures that we have instituted to keep you safe. We continue to test all patients coming to the hospital. We are maintaining COVID-free zones, and we will not relent in our efforts to ensure adequate PPE for our colleagues, patients, and visitors. He states, "We are here for you. We will continue to make priority of your safety and ask that you all continue to take care of yourself and others. We urge you to continue masking in public places, washing your hands, physical distancing to keep infection rates low. If we can do that as hospitals and businesses and community members, we have the opportunity to keep this harmful virus at bay and emerge stronger together." And again, this is from, he sends his regrets. He's away, Dr. Robert Roos, the Chief Medical Officer of Mercy Medical Center, Trinity. So Dr. Roos, I appreciate that. And I also appreciate the close collaboration, cooperation, partnership, and friendship we've had with Bay State and Mercy. We worked very closely together to make sure, knock on wood, if and when there's an uptick, that they're able to handle that capacity. We hope we don't get there. They've been a great, great partner. And Dr. Sarah Hessler is here, and again, she's the infectious disease specialist and heads up that whole division for Bay State Medical Center, Bay State Health System. So without further ado, Dr. Sarah Hessler.
Thank you, Mayor Sarno. All right, I'm going to remove my mask as well. I think we're probably far enough away from each other here. And get it off without losing my glasses as well. There we go. Great. So, good morning. As Mayor Sarno indicated, I'm Sarah Hessler. I'm an infectious disease specialist at Bay State Health, and I am the hospital epidemiologist. And so what that means is that I create and oversee programs to prevent people from getting an infection they didn't come in with, or from our healthcare workers acquiring or transmitting infections either between themselves or patients, or picking something up from patients. So pandemics are right up our alley. Anyway, I also want to thank Commissioner Carlton-Harris for all of her excellent work in public health. It's extremely important to have a well-functioning public health system in our community to help keep us all safe. I also want to thank my colleagues at Bay State Health. As many of you are aware, and as Dr. Kerouac has probably indicated, we've cared for a tremendous number of patients at Bay State Health System. Over 1,000 patients have been hospitalized with COVID-19 across our 4 hospitals in this region. And our healthcare workers have just been so dedicated and compassionate, and I really want to give them a shout out and thank them all. Currently at Bay State, the number of patients that are hospitalized with COVID-19 remains low, comparatively speaking. Whereas during the peak of our surge, our peak was in mid-April, we had an entire tower at Bay State Medical Center dedicated to the care of COVID patients, and we're doing almost nothing else besides COVID. Now we have consolidated all of our patients into 1 unit plus some ICU capacity. So in the past week, we've ranged between 14 and 20 patients being cared for COVID within our hospitals across the system on any given day. The remainder of our hospital capacity is being utilized for standard non-COVID care of patients. And as was indicated in the statement from Mercy Medical Center, we also have our COVID patients consolidated to 1 COVID unit, whereas all other units are non-COVID units. So in terms of testing, we continue to test 300 to 500 patients per day. Our percent positivity rate is 1% to 2% positivity. As anybody who has undergone a invasive procedure for which they were going to get sedation knows, we are testing people prior to those procedures as an outpatient, so that drives some of that volume. These are not all patients that are actually symptomatic. That, when I say 300 to 500 people, I'm not saying 300 to 500 are symptomatic. Many of these people are asymptomatic and are being tested for those purposes. And then I just wanted to briefly address some of the concern that's been in the press and the literature regarding a disproportionate representation of racial and ethnic minorities in terms of the being affected by COVID-19. So at Bay State Health, we have a team of physicians, nurses, community health workers, social workers, et cetera, who, and data scientists who are monitoring all the patients who test positive for COVID-19 through the Bay State Health testing system. And we're monitoring their, their age, their gender, the town that they live in, and if we know, what is their racial or ethnic makeup. So with that, we are using our data scientists to help us to try to understand are patients clustered in certain areas, and we've been partnering through our community health centers, so that's Brightwood, Mason Square, and High Street, as well as Caring. We're partnering with Caring Health Centers to, first of all, provide testing to people who, when they test positive, we're offering testing to their close contacts, so family members, household contacts, and trying to assist the public health interventions that are taking place by making it easy for people to get tested. The second is that we're working with a variety of religious and community leaders to try to provide education around keeping ourselves safe. So mask wearing, social distancing, hand hygiene, and how to safely quarantine in home if you have been exposed or you have a family member that's ill. As was pointed out earlier in the statement from Dr. Roos, the United States really is continuing to struggle quite a bit with this pandemic. So as of this weekend, there were 3.3 million cases of COVID-19 in the United States and 135,000 approximate deaths. And this past week has been marked by records set on a daily basis for the number of new cases. Some states, particularly in the South and the Southwest, are being hit particularly hard. Florida, Texas, Georgia, Arizona, and Louisiana. There are excellent websites for anybody who's interested in tracking exactly where these cases are clustering. One that's particularly good is the Johns Hopkins website, where they are tracking numbers not just nationally but globally, and is an excellent reference for anybody who's interested. In contrast, Massachusetts and other northeastern states are doing very well in terms of our numbers. We continue to have low numbers, relatively speaking, compared to other parts of the country. But that doesn't mean that we should lose our vigilance. The biggest risk within our state, frankly, is the importation of cases from outside of this region. Summertime is a time when people travel. They visit family members and friends, and that is a very large risk for people to bring the virus with them when they come, or for people who are traveling from our state to some of these hot spots may inadvertently become infected and then import it back in. And so this is why and I'm going to speak about this a little more, but as we travel or as we have people coming to visit us, social distancing, mask wearing, hand hygiene. I'm going to sound like I'm beating a dead horse here, but this really works. It's incredibly important, and this is the way that we're going to protect ourselves from re-importation of cases into this region. I want to address one other aspect that has been in the news media recently, and some people have already heard me speak about that. And that is regarding a controversy that's been raised around whether this virus is transmitted by the airborne route or by droplet spread. And for those who are not familiar with this controversy, there was a group of scientists who submitted a letter that to the World Health Organization, the WHO, expressing concern that there wasn't enough attention being paid to the possibility that this virus could be spread through the airborne route and not just droplet. And the WHO did consider their letter and has subsequently come out with a statement. And it is, again, supportive of their original position. And I want to explain a little bit more for everyone, just so that we can understand how to keep ourselves safe in relation to some of this discussion that's going on around us. So in healthcare epidemiology and in the work of hospitals and what we do to keep patients from getting somebody else's infection or giving their infection to someone else, there are these two different ways that people transmit infection. And it really has to do more with the actual pathogen that's being transmitted than anything else. So that is airborne and droplet. So droplet things are, for example, influenza is a classic pathogen that's spread through the droplet means. Droplets are something that are sort of, relatively speaking, on a microscopic scale, but large on a microscopic scale, wet and heavy droplets. So if I had influenza and I coughed or sneezed or sang loudly or spoke, these little droplets come out of my airway and they scatter 3 to 6 feet away from me. If somebody who's susceptible to that is within 3 to 6 feet and their mucous membranes, their eyes, nose, or mouth are not protected, then my droplets that are infectious could get on those mucous membranes and cause infection. And that is very different than what we call airborne spread. So the classic diseases that are spread through the airborne route are tuberculosis. SARS was spread through the airborne route. measles, and varicella, or chickenpox. So these are much smaller particles, and they, when you expel them, float in the air on air currents for up to 2 hours after the person has left the room. It creates a very different pattern of infectious spread than droplets do. And the concern on the part of the scientists who wrote the letter was that it is theoretically possible to aerosolize this virus. And they're correct. It is theoretically possible to aerosolize the virus, and we've known that for a while. And that is why we have healthcare workers wear special fitting masks, the N95s, or a PAPR hood, when they do procedures that are known to aerosolize the virus. So, for example, when a breathing tube is inserted down someone's throat, if they're critically ill and they need to be put on a ventilator, that's a procedure that would create aerosols. And so we know that this occurs, but it's not how the virus is transmitted for the majority of the time. And it's really important for us to understand that. And so the way that this is spread predominantly from normal people that are not undergoing procedures is that it is spread through this droplet route. That is why it's critically important for all of us to practice these basic forms of hygiene. So the first is to wear a mask around other people. The reason for that is because the virus can be transmitted 2 days before you start developing symptoms. So you may not think that you're sick, but for 2 days before you're developing symptoms, you could actually transmit the virus. In addition, some people develop no symptoms at all or just very mild symptoms, and they may not think that they have COVID-19, but yet they could be spreading the virus. So mask wearing by all people helps to protect everyone around you. It's good manners to wear a mask, and that's why we want to help to protect our family, our friends, and people in our community that are near us. The second is social distancing, and that is around the idea that if you stay 6 feet away from other people, everyone in the room here is standing 6 feet away from each other. The point of that is that if somebody like myself was infected with something that is spread through the droplet route, people staying far away from me, their mucous membranes aren't within the range of my droplets. So that's another second way that we can protect ourselves. And the third way is through hand hygiene. So cleaning our hands very often. And that is because, again, if I were infected with something that was spread through the droplet route and I coughed or sneezed, it could get on these flat surfaces around me. If somebody else were to come along and touch it, and then touch their own mucous membranes, they could transmit the virus that way. So that's where cleaning your hands very frequently and not touching your mucous membranes is the way to help protect ourselves. So I hope that's been clear in terms of those differences. And with that, I'm happy to stop or take questions if anybody has any right now.
Dr. Hessler, you did a great job. We appreciate you being here. Dr. Hessler will take any questions or comments you might have, and she can get back to Bay State. So any questions or comments?
Yeah.
Dr. Hessler,
Yeah.
I'm curious if there's, as we are thinking ahead to the hopefulness of the vaccine or something like that,
Yeah.
there's obviously a concern about whether or not there's natural immunity to this virus at all. Have you seen either in Bay State or in literature any proof that people have actually been reinfected with the virus up to this point? Because we see some communities in like New York, which basically a mathematical or herd immunity. Not everybody is, obviously, but if you're not developing natural immunity, that also casts doubt on vaccines as well. So I'm just curious if you've heard anything about that.
Sure. That's a great question. For anybody that didn't hear it, I'm just going to repeat it for the sake of the microphone, so that, and I'll paraphrase you if that's okay. The question was, is there any evidence that people develop lasting immunity? And number two, is there any evidence that people can get reinfected with this virus? And the answer is probably, to the first thing, do people develop protective immunity? The answer is probably, but we don't know yet. There are lots of people that are working on this to try to determine exactly how long antibodies last. We can demonstrate through antibody testing that people do develop antibodies to this, and there's lots of studies in the literature that demonstrate that antibodies are developed. but are they protective antibodies, and how long does that protection last? And that is not yet known. The second question around is, has anybody been reinfected? That, again, there's no published reports that I'm aware of, unless some case report came out this morning. I'm not aware of anybody that has reported somebody that has had a bona fide reinfection. Again, anytime that we're dealing with a novel pathogen like this, things change all the time. They change so quickly that, you know, it's hard to say a definite yes or no when we don't have any answers yet. And sometimes it takes a long time for things like reinfection, if it were to happen, to have enough time to develop, if that makes sense. Right, so we've only known about this virus since mid-December, and if immunity lasts that long, then maybe that's what's happening, but we don't actually know.
And so, I'm realizing that I had a chance to read, there's a report published in, or not a report, it's a first-person account from a doctor in Vox.com that was published about saying somebody got tested positive 2 months after they'd previously been diagnosed. Is there any caution that you could give to people as saying, like, not necessarily take one case as a trend?
Yes. Yeah.
But I imagine that would be rather alarming for
Yeah.
some people that may read that, you know, account from a doctor.
Yeah, you know, I don't want to get too technical here. However, I think it's very important for people to understand a basic concept around this virus and the detection of this virus, okay? So, and that is that the state-of-the-art way that this virus is diagnosed is through something called a PCR, or polymerase chain reaction. And so the swab that goes down the nose, it's then put in a very fancy machine, and the machine is its whole way of detecting the virus is through amplifying a genetic sequence that's specific to that virus. If there's no virus in the sample, it won't be amplified enough to be detected by the machine. If there is virus in the sample, then after a certain number of cycles of the machine going through the process, it will detect the virus, okay? So the lower the number of cycles it takes to pick up the virus, the more virus there is there. Okay, it's called a cycle threshold for anybody who wants to know the kind of nitty-gritty details. I don't want to lose you here, but the idea is that the less virus there is, the higher the cycle threshold, the more number of cycles that it will take to pick it up. There is increasing numbers of reports of patients that test positive repeatedly, then they're not positive, then they're positive again, so this sort of intermittent positivity for months. Okay, and these are people that have high cycle thresholds, very little small amount of virus right at the edge of detection. There's an excellent case series from the Korean CDC that I'll refer you to look at this, called Re-positive. Okay, and they looked at hundreds of patients in Korea who were Re-positive. What that means is that they had tested negative and then tested positive again. And the evidence that they demonstrated, they did extensive research on this population of patients who did this. What they proved is that they have high cycle thresholds, so very low viral load, not contagious, did not infect anyone else. Majority of them had no symptoms whatsoever. Sure.
Thank you, Don. You have questions, comments? Doctor, thank you so much.
My pleasure. Oh, yeah, sure.
Paul, I'm sorry, I didn't see you there.
Yeah.
Has Bay State had any issues with testing supplies? I've read accounts that there are some hospitals and clinics in the state that have had issues with testing supplies. The nasal swabs that you mentioned being one of the things that they're short of. Has that been an issue for Bay State?
Yeah. Great. So again, just for the sake of clarity, not everyone can hear each other in masks. The question was, has Bay State experienced any difficulty in getting an ample supply of testing equipment? And the answer is Yes. And we have leaned heavily on our representatives, so we want to thank everyone who has put effort into helping us to acquire what we need. This is a national problem. It's not unique to Bay State or Mercy or any other hospital or health system in Massachusetts. It is a national supply issue, and there are shortages of multiple things. So the first is the nasal swabs, the actual swab itself, something called viral transport media, or VTM, which is the little pink liquid that it's very specialized that the swab goes into. So those are two things. The third is the reagents that are required to run the PCR machine. So certain of the platforms that are used to test patients, particularly the ones that have a quick turnaround time, very rapid. So we have one at Bay State. It's the Cepheid platform. It's a 2-hour turnaround time. Nationally, they have extremely limited supplies, and every hospital that uses this platform across the country is on something called allocation, meaning that you only get this small allotment, and sometimes you don't even get the allotment. It makes it very difficult for us to be able to plan throughput through the hospital as we're trying to test people rapidly. But we do have excellent capacity with our, we have several PCR platforms that are high throughput, meaning we can run multiple specimens, more like 90 rather than one at a time. And so we can do higher volume, but the downside of that is that it takes 8 or 9 hours for the test to go through the complete cycle from obtaining it to getting the result. And so again, it's more of a hospital operations issue than it is an availability for people or patients to get tested, if that makes any sense. So it's really more what we deal with in the background than what we have to offer, because our workaround is that we can offer to ample testing. It's just that for our operations purposes, it's quite challenging.
Have you seen an increase in demand for testing? I mean, I know you said test people, a lot of them who are testing are asymptomatic because they're being tested before they're having a procedure done. But have you seen an increase in demand for testing from people who have symptoms?
As far as I know, we're not seeing, so I'm sorry, so the question is, are we seeing an increase in demand for symptomatic people getting tested? And the answer to that is, over the last week, we haven't seen an increase in demand for symptomatic testing. There's lots of other requests for testing that again, around asymptomatic testing, things like return to work or return to school, these sorts of things as well.
So
Yeah.
this is kind of, I don't want to say routine testing, but testing that's not being driven by a concern that we're seeing more virus in the community.
Correct. And we do not believe that we're seeing more virus in the community this week compared to last week, for example. However, again, we remain extremely vigilant because we're very worried about how many cases there are in the rest of the country and the possibility that that will lead to a second surge in the Northeast. And I can tell you that we have seen people that have come from places like Florida, and that was their risk factor, is that they came from Florida and or somewhere else that has high case load right now. Yeah.
In part of this is my last question.
Sure.
Part of the phase 3, part of the phase 3 reopening of narrowly to casinos open to the public today, the basketball hall of fame, so museums are open. Now, obviously, they're limited capacity, but these are all facilities that their business model depends on attracting more people coming in and people coming in from states. So is that a worry in the healthcare community that we have these types of facilities now open?
Okay, so the question was, if now that we're moving into phase 3 and places like casinos and the Basketball Hall of Fame are opening, is there a concern that will, because these are places that attract people, will that lead to an increase in number of cases? And so Of course, there's always concern, and I think that that is probably why the governor has been so cautious about reopening the state. And so the success of any reopening strategy depends on each of us taking personal responsibility for wearing a mask, for keeping 6 feet from other people, and for practicing hand hygiene. And it really comes back to that. It always comes back to that. Everybody has to do their part to protect Massachusetts from having another surge.
Thanks, Paul. Dr. Hessler, thank you.
Great.
You were fantastic.
Fantastic. Thank you.
Thanks for what you're doing, and stay safe and stay
My
healthy.
pleasure. Thank you very much for inviting
My
me.
pleasure. Thank you, Doctor. And John, let me give you a clarification. I was thinking of Bobby Hastings. John, Mom, okay. Paul, it's an interesting question. I was asked that question on CNBC earlier this morning pertaining to the, now with MGM and other attractions opening up. Well, what we had told them too was all the precautions that they're taking, and what Helen has been saying for a long, long time, the contact tracing, which is very, very important. It's a balancing act. You know, we're trying to follow the medical, the health, and the public, and the sciences. But we're also trying to get our businesses open and going again. MGM had a specialist in there too. Helen can elaborate on that. And I think that Dr. Hessler made a good point. Many times when you're looking in the mirror, people are always pointing fingers. Hear what the doctor said, personal responsibility. And each and every one of us need to practice that. So I think our collaboration, working closely with the hospital, is key. And the preventative work, proactive work is key. But if someone does contract it coming from the outside, then the contact tracing is extremely important. And they have that information of people coming in. So I believe, maybe Helen can go into that, that information is relayed also on. So we'll move forward from there. But I really appreciate Dr. Hessler. You see, I mean, she's the chief specialist now, taking the time to be here. And speaking of chief specialist, Helen Carlton-Harris, my Commissioner of Health and Human Services, will bring you up to date on our overall situation and elaborate on that. Helen Carlton-Harris.
Thank you, Mayor. Again, thank you for your leadership as always.
Thank you.
In the Commonwealth of Massachusetts, there are 105,629 confirmed cases. The probable is 5,968. Now, I've been asked many times around the question about probable. Probable is a case that meets the laboratory evidence and the clinical criteria, but does not have a positive test. So those individuals are considered probable, but have not had a COVID-19 positive test. The total cases, when you combine the two, is 111,597. The mayor indicated 2,722 are from the city of Springfield. I've also been asked why our numbers differ from those that are released from the Commonwealth on Wednesday. That is because early in the epidemic, when we went through the cases for the city of Springfield, we found some redundancies. There were some that were repeated. And so we went and scrubbed those cases and came up with the number that we are reporting. So I wanted to clarify that because those questions are being asked. The mayor told you about our deaths, 124. We are again feeling and grieving with those individuals who are experiencing a loss in their families. I won't repeat the data around the numbers as far as white, black, Hispanic, and Asian are concerned. The mayor has given you those, but I will give you the percentage. 45.16% are white, 29.83% are Hispanic, 23.83% are Black, and 1.61% are Asian. We have attested one additional individual who is homeless who has tested positive. Testing, I am very appreciative of the legislators in the Commonwealth of Massachusetts who stood up and said that we need the state to stand up asymptomatic testing sites in the city of Springfield. We are grateful to Bay State Health, Mercy, as well as Caring for doing testing, but right now you still need a referral. You do need a physician's note, even if you're asymptomatic. And so it is important that we have testing sites that people can get tested on demand. When they want to have a test, we believe strongly that people should be able to do that. The supply chain could be a challenge, but I believe that if the Commonwealth can stand up testing sites in other parts of the state, they certainly can do that same service in Western Massachusetts, and currently that is not the case. And so I want to thank the legislators and the mayor who continue to advocate for testing sites, and it is critically important that we are able to test asymptomatic individuals. Contact tracing. It is very important. I've said over and over again how important contact tracing is and how it's important to give us the information that we need when you hear from us so that we are able to stem the tide by contact tracing. Recently, there have been reports across the nation, as well as in the Western region, that there have been individuals who have been posing as contact tracers to get sensitive information from our residents. Let me say, no contact tracer will ask for your Social Security number or financial information. If that does happen, please know that that is not a contact tracer. Hang up and report that individual to the degree you can. You can report it to our hotline, or you certainly, I know that there are mechanisms in law enforcement to be able to do that. But it's important to know we will never ask you for your Social Security number or information that we do not need. Residents who call us on the telephone are asking about two things during our hotline. One, face coverings. We get a lot of reports around entities that are not doing the right thing as far as face coverings are concerned. Face coverings are still mandatory in the Commonwealth of Massachusetts, in stores, and in essential services. It's important when individuals who go into stores feel comfortable, and they are comfortable when they see that people are taking the face covering mandate as seriously as they are. We have individuals with underlying conditions or who are over the age of 55, 65, and they want to feel safe. I am asking once again those stores to make sure that you are requiring face masks when individuals come into your store, unless they have a medical condition where they cannot wear a face covering. Again, we want to make sure that we are working together. There's so much that's unknown about this virus. We really don't know. And while young people, you feel that you are not vulnerable, I have to tell you, we have no idea what this virus is going to do long term as far as lungs are concerned for even young people. Again, there's so much that's unknown, and we're hearing more and more about young folks in their 30s, 40s, and even 20s who are COVID positive. Please do not put other people at risk. And I think that our Bay State individual who just gave us information was very clear. Protect yourself, so that others can protect you. That's really what we are trying to make sure we're doing. Another call we get is around when are the basketball courts going to open? That is another hotline question that comes. We will not be opening basketball courts. It is a high-risk, high-contact sport, and we cannot take the risk of opening basketball courts and spreading the virus. We want to keep each other safe, and we want to keep those individuals who are playing sports, basketball and other sports, as safe as we can. But we know that basketball is a high-contact sport. We also know that even in the NBA, they are going to play in a bubble and in one facility. And so we know that we have to stay vigilant around keeping our basketball courts closed. When the time comes that we can open them, that will happen. We want young people to be out exercising and doing the sports that they love. But right now, basketball is not popular. EEE, I'm going to move to mosquito-borne diseases. EEE, Eastern equine encephalitis, EEE, is a concern, as well as West Nile virus. You should know that the state puts traps across the Commonwealth, and so there are traps in the city of Springfield and the Western region. The state then collects the mosquitoes from those traps, they test them, and that's how they know that there are mosquitoes who could potentially infect in our area. We will know when we have that situation because the state will report it to us. They will also report to us if anyone in the city of Springfield or the Western region test positive. During this time, it's really important that when you go out dusk to dawn, please cover your arms and your legs and use mosquito repellent that has DEET. We know the symptoms of EEE, which are headaches. We understand that fever is also a part of that mosquito bite. However, West Nile virus, 80% of individuals show no symptoms. So we think that it's important that individuals protect themselves at this time. The city of Springfield does not spray for mosquitoes. We use larvicide. We put it in the sewers to keep the mosquito population down. We have done that. We will continue to do that. So again, mosquito season, we're concerned about COVID. There's a lot going on in the environment at this time, and we're asking people to protect themselves. Wearing a mask, social distancing, hand washing, those are currently the defense we have against COVID-19, and also cover yourselves when you're out from dusk to dawn to prevent getting bit by a mosquito and potentially getting a mosquito-borne virus. We are in this together. We've said that over and over again. One of my favorite quotes is from Cornel West, who wrote in Race Matters, we are on a slippery slope towards economic strife and social turmoil. And he says if we go down together. And I think that's what we've been saying as far as prevention and intervention and face covering, social distancing, and hand washing is concerned. If we do these things, then we can protect each other. But if we don't, we are going to impact each other. And as the statement says, if we go down down together. Continue to be vigilant and understand that we are working with you for a healthier community. Thank you.
Thank you, Colin. Thank you, Commissioner Carlton Harris. Appreciate that. And we'll go down to the public safety component. We'll start first with fire with Fire Commissioner Bernard B.J. Calvi. Again, they had a very difficult fire in Alderman Street Friday evening into the early morning hours, and they did a tremendous job knocking that down so it did not spread. That's a high-dense area, Sorrento Street, Alderman Street, Pasadena's right across the way there, and Granada Terrace. So without further ado, the Fire Commissioner of Springfield, Bernard B.J. Calvi.
Good morning, Mayor. Good morning, everybody. Thank you. So, as the mayor said, we had a busy weekend. We had a 3-alarm fire on Friday night. Fortunately, only one firefighter received minor injuries. He was treated and released from the hospital. No residents were injured in the course of the fire. 2 buildings were totally destroyed, and was a very bad fire. It was coming through the roof on arrival, so got a good head start on us. We didn't receive any 911 calls on the fire. It was actually called in by a police officer who was in the area. So it got quite a big head start on us, but we were able to save the other houses in the area. As the mayor said, it was a pretty tightly packed neighborhood. On the COVID front, we have no one out currently with COVID-related illness, so that's a positive. We did have another fire yesterday, which was due to someone cooking outside. Everybody, just to remind you, be very careful using your grills or barbecuing near your residence. Make sure you're at least 10 feet away from your house while you're doing that kind of activity. And that's all I've got for today. Thank you very much.
Thank you, Commissioner Calvi. Thanks, BJ. Springfield Police Department, under the command and leadership of Commissioner Cheryl Clapprood, continues to be out there day and night to keep us safe and sound and tackle all the challenges that will come the way of a police department in urban America. And I'm proud of our efforts, and I'm proud of the men and women in blue as we continue to move forward and bring some new initiatives on board. And I know Helen says many times, the community working together with each and every one of us and taking personal responsibility. So without further ado, the Springfield Police Commissioner, Cheryl Clapprood.
Thank you, Mayor. Good morning. We have 0 out due to COVID. For the weekend, on Friday afternoon at 4:45 p.m., we made an arrest on Central Street. An 18-year-old shooting a vehicle was hit. He was arrested, the gun seized. We assisted, as Commissioner Calvi said, with Springfield Fire on Alderman Street. A shout out to Officers Ruffalart and Tavares, who were the initial spotters of that fire and assisted until the Springfield Fire personnel responded. So between the 2 officers and Springfield Fire, thank God nobody else was hurt. That was great. Sunday morning, 1:45 a.m., 2 people shot on Hancock Street, both non-life-threatening injuries. Again, they are both being uncooperative with us. Sunday morning at 3:50 a.m., officers respond to a gun call. We recovered a ghost gun on High Street after a foot pursuit. The subject ran. The gun was loaded with 13 rounds, and a 30-round magazine was also recovered. Subject arrested, and the person on the gun seized. Sunday last night, 8:45 p.m., officers located a 4- and a 6-year-old in the car with just the windows cracked slightly. It was 89 degrees outside and much warmer in the car. Mom was shopping inside Walmart. An arrest was made on that. Thank you.
Thank you, Commissioner. Now with the Parks and Facilities update, Pat Sullivan and his team have done a great job as we continue to move out of Phase 2, the second part into Phase 3, and he'll have some updates that we're now allowed to do following all the strict guidelines, health guidelines in Phase 3. The Director of Parks and Facilities Management, Patrick Sullivan.
Thank you, Mayor. Good morning. We continue to clean and monitor all building activities, and under the advice of our Health Commissioner and Mayor Sarno, we have kept our temperature checks at both Tapley Street facility and City Hall, and I think that will be the case going forward. We're very thankful to the parents and guardians throughout the city of Springfield. We have the 18 splash pads open, and driving around all last week, everyone was being respectful and mindful of the guidance that we have set forward, so we appreciate your continued cooperation. As the mayor stated, the Carriage House in King Philip Stockade can now be rented for 65 guests, and then Emma's Place on Parker Street is available for rental for 45 guests. The governor has put guidance forward in Phase 3 for sports. Field permits can now be obtained for low and moderate risk sports. Those are two of the categories. The last category is high risk. So the examples of low risk are tennis, pickleball, swimming, disc golf, individual biking, and fishing. And the moderate risk are baseball, softball, crew, track, cross country, team swimming, and volleyball. High risk are football, wrestling, soccer, rugby, basketball, lacrosse, ice hockey, and martial arts. So with this guidance, just really the low and moderate risk can move forward, and we will continue to wait for the governor's guidance as we move forward. Thank you.
Thanks, Mayor. Thank you, Director Sullivan. Now on our street services, and again to DPW Director Chris Signoli and his team. They've been there from day one and continue to put the efforts across, whether it's trash or recycling, street work, or DPW efforts, and really appreciate the men and women of DPW, unsung heroes. So without further ado, Department of Public Works Director for City of Springfield, Chris Signoli.
Mayor, thank you. And I do have to echo him and thank the employees of the DPW for all the work that they've done beginning in March during this pandemic. With regard to DPW, number one, just want to remind people that the Tapley Street facility, it is still required to have an appointment to get into the building. We're seeing a lot of people showing up now. You still need an appointment to get into the building. The state of Massachusetts has finally done final approval for our roadway money. So our paving program for this year will be starting this week around the city. And as I've mentioned in the past couple weeks, on a daily basis, we're running behind a little bit on trash, recycle, and yard waste pickup. We are getting to everybody on the same day. It's just a little later in the day, and that's going to continue throughout the summer due to the number of employees that we have either out on vacation, COVID, or on workman's comp. With that, that is it for the DPW. Thank you.
Thank you, Director Signoli. On the economic development front, Chief Development Officer Tim Sheen and his team have done a fantastic job. When you look at it, in essence, with the federal money that we're putting across to help residents with their mortgages and their rents and the utilities, plus the economic business money we've put out, you're nearing about $5 million that we have put out almost immediately to make sure that our residents and business community continue to get back on their feet. Tim will give you an update on Prime the Pump. He'll give you an update on the nonprofits, COVID, and nonprofits CDBG moving forward. So without further ado, the Chief Development Officer of the City of Springfield, Tim Sheehan.
Thank you, Mr. Mayor. We're finishing up the scoring on the round 3 of Prime the Pump. We're expecting that within the next couple of days, we'll release those awards. We are also in the midst of the nonprofit round. Applications are due in the 17th before 3 o'clock. If you are a nonprofit entity and you have COVID-related issues in continuing your nonprofit work, please grab an application, complete it. The applications are easy to complete and get it submitted by 3 o'clock on Friday for consideration. And finally, I wanted to indicate we have now turned our attention to the Public Service Normal CDBG Community Development Block Grant Program. Applications came in February with regards to that. July 1st, that money was made available to the city, and we are now looking at those applications. We've reached out to all of the applicants to determine if COVID has had any impact on their programming that they applied for. So those responses are due back into us by Friday. So once we get those, we'll assess that and move forward with consideration on funding those grants. Thank you.
Thanks, Tim. Thanks, Director Sheehan. Gave the update with Solicitor Pakula and Attorney Bill Mahoney. Was pretty status quo on that. So at this time, if there are any questions pertaining to my cabinet heads or myself, we'll take those questions now. And again, I appreciate the media continuing to get our message out. So I don't know if there's any questions. Paul?
Mayor, this issue with regional disparity of testing is coming up over
Yeah.
again. Have you had conversations with the Baker administration about this? Why aren't they offering the testing in Western Massachusetts the way they are in the other parts of the state?
Yeah, I have had conversations, and those conversations happened early on, too, that we're looking for equity out here. So I'll be awaiting that some testing will hopefully be happening out in the western part of the state on it. But we've had, very good relationships with Governor Baker, Lieutenant Governor Polito. As you know, I went pretty hard and pretty strong when I had to get the PPEs, and Helen and I, in a respectful manner, and we wanted to get more testing directly out here. So they know that we want more testing out here in Western Mass, and I'm sure that they'll move forward to make that come about. And I appreciate the legislative delegation bringing up that matter again also, but that's something you reported on some months ago on PPEs, and we need testing our way. Any other questions or comments? Yep, Matt.
I have a question for Mr. Papa.
Sure.
I wanted to add anything to what Mr. Palmer said about potential fraud involving contact tracing. Is anything that the local police department is planning on at all?
Yeah, thanks, Matt. Yeah, we have been getting some complaints about that. They don't know if it's a legitimate contact tracer or somebody just trying to get information. And there's a couple scams going around, and the Detective Bureau will handle that, and they'll investigate that fully. There's also some phone calls coming in from unknown numbers that are asking for donations now for different law enforcement agencies. The Springfield Police Department is not conducting any campaigns at this time for funds, and there's no one locally that I know of. So if there's anything like that you get, simply, if you can get the number that it's coming from and let us know, we'll continue to work on it. But yes, we've had a couple complaints about the contact tracing.
Matt, we also have my office, Mayor's Office of Consumer Affairs. Millie Johnson does a great job. So many a times she is coordinated in these response and speaks to those individuals. And, shame on those people that are doing that, especially to our senior population. It's very disturbing that someone would take advantage of that. But yeah, my Mayor's Office of Consumer Affairs with Millie Johnson and her team do a great job. They're directed up that way. When it becomes a criminal civil matter, obviously with the police department becomes involved. You also have the hotline. Helen's Carlton Harris is the health department's hotline, and that information is pushed forward, as it is when it gets to 311 in my office too. Any other questions or comments? Okay, thank you everybody so much. Stay healthy, and to the residents and business community of the city of Springfield, I deeply appreciate your cooperation, your collaboration, your patience and understanding. As we always say, we will defeat this COVID-19. Moving into this phase 3 now, and a hopeful phase 4 with a vaccine coming about hopefully in the near future, we need to be cognizant, even as we start to open up more and more, what Dr. Hessler indicated, what Commissioner Helen Carlton Harris indicated, what I and many other medical professionals have indicated. Wear that mask when you're out and about. Wash your hands. Practice that social distancing, physical distancing. That's extremely important. And if you don't feel well, stay home. What we're doing is showing that we're moving in the right direction from Governor Baker on down here in the city of Springfield. So we have to stay ever vigilant, please. We're not out of this. I know there's a lot of things hitting all of us, whether here in America or in Massachusetts or in Springfield, but we are still tackling all these issues or conquering all these issues in the midst of a pandemic, and we cannot lose sight of that. Last thing I'll say, again, to my cabinet heads down to rank and file, tested and true. including myself, none of us are perfect, but they're working hard day in and day out for you. So when you can give a shout out, give a shout out. And again, I appreciate any type of constructive criticism too. Stay healthy and God bless. Thank you very much.